The transducer should be placed gently on the patient abdomen with minimal pressure. Applying abdominal pressure with the transducer will not improve image quality and is uncomfortable for the patient and for the operator. The two images showing how to hold our probe when we are scanning the patient. We should not apply too much pressure on the patient's abdomen. On the right side is a best way to handle our probe when we are scanning, while the left side is a wrong way how to handle probe. So we should ensure that we hold our probe firmly and not more pressure much on the patient when we are scanning. This is another image showing the direction of the location of the transducer marker and the scanning transversely. And you see the patient on the right side too. So this is another one showing the patient scanning longitudinally. You see the transducer marker and the marker is pointing to the uterine fundus. Furthermore, pressure on the abdominal may result in a fatal brachycardia in some instances. The only instance where dragging the transducer is justified in its late pregnancy when the fetal head is low in the pelvis and evaluate of head anatomy and biometry is difficult. Ultrasound scanning techniques. Understanding that the ultrasound is an operator-dependent image modalities, there are some scanning techniques that can be improve your image and maximize visualization of fetal anatomy and adnexal structure. The first one, to select the appropriate ultrasound transducer and settings. Apply minimal pressure on the abdomen, reduce depth to a minimum, minimize the sector width, adjust the focal zone, zoom area of interest, and maintain the target anatomical area in its center of the screen. Ultrasound of non-pregnant uterus. Ultrasound is the most optimal modalities of the evaluation of the uterus and should be used first when the patient symptoms suggest of the presence or other surrounding organ abnormalities. The approach to imaging uterus by ultrasound can be accompanied by the transabdominal or transvaginal routes and is typically dictated by the types of uterine pathology being evaluated. With the exception of large uterine mass such as uterine leiomyoma, which extend the uterus outside the pelvis. The transvaginal approach, with a high resolution and close proximity to the pelvic organ, it is preferred as it is enhance the sonographic depiction of normal and abnormal uterine anatomy. When the transvaginal is not feasible, the transrectal or translabial approach can be used as alternative to transvaginal.